The latest government advice, which came out on Monday, was firstly that rather than symptomatic people being advised to stay at home for 7 days, the advice now is that if somebody in your household becomes symptomatic, then actually the whole of the household needs to self-isolate for 14 days. So the people who are most at risk from COVID-19 are people over the age of 70, people with long-term conditions, and that's the same long-term conditions that would enable people to have a free flu vaccine, and pregnant women. Okay, so social distancing refers to anything which reduces the contact between people in our communities. So that could be anything from working at home to reducing the use of public transport. Basically, it's around stopping all non-essential contacts, which includes, again, avoiding small and large gatherings and not going to clubs, pubs and restaurants. So at the moment, the people who need to stay at home are those who are symptomatic and all of those households. So if you had a household of 3 people and somebody became symptomatic, then the whole of the household would need to stay at home and self-isolate. The person who became symptomatic first could go back to their normal activities after a week, but the other people would still have to stay at home for the 2 weeks. And the reason for that is because after the first 7 days, we know that the person who originally had symptoms is less likely to pass that infection on to somebody else. But of course, other people in the house might be incubating the infection. So we need to keep those people who haven't developed the infection at home for the additional 7 days to make sure that they are not going to develop symptoms. The other group who we're encouraging to stay at home are those vulnerable groups. So that's people over the age of 70, people who have got long-term conditions like chronic kidney disease, heart disease, respiratory disease, diabetes. As I said before, all of those people who would be eligible for the free flu vaccine and pregnant women, the government is advising that those people also stay at home and reduce their social contact with other people. So self-isolation really refers to staying in your own home and really reducing your contact with other people, both inside and outside your household. If you've got symptoms and you're self-isolating at home with other people, then the advice is that you try and stay in a single room. If you're lucky enough to have 2 bathrooms, then use a bathroom that other people in your family don't use. Don't share utensils and plates and eating, crockery and what have you, and use a separate towel. So all of those things are part of the social isolation process, but there's some really good advice on the government website about how you self-isolate at home. There's lots of things that people can do to help. So first of all, because coronavirus is a respiratory disease, it's spread by people coughing and sneezing or by other people picking up infections from touching door handles and the tops of stair rails and the like. So the 2 things that people can do are to wash their hands really regularly for at least 20 seconds. And the second thing that people can do is to, if they feel like they're going to cough or sneeze, then cough and sneeze into a tissue and then bin that tissue and wash your hands. So that's one thing which is a really important thing to do. And the second thing to do is to just follow the government advice on reducing contact with other people, because that's really what's going to suppress transmission of this infection in our communities, and that's what's going to protect our most vulnerable people from becoming infected. Because although in the majority of people this infection is quite mild, in some people, like people who are older or people with long-term conditions, this can be quite a severe infection. Obviously, we want to protect those people and minimise suffering. There's absolutely no reason for people to stockpile food, medicines or other household goods. In fact, there's a number of reasons why that would be actually quite a bad idea. So firstly, if people stockpile food, that means that other people find it really difficult to access food and household goods that they would normally need to, function on a daily basis. And in practical terms, that means that people who are more at risk, so older people, people with long-term conditions, and all these other people who are isolating at home, it's going to make it much more difficult for them to get hold of items which are essentially going to maintain their health and well-being. And the other issue is that for all of our key workers, like social care workers and healthcare workers, they too are going to find it difficult to get hold of food and household goods that they need to maintain their health and well-being. And these are the people who are going to be looking after us when we're unwell. So, let's not stockpile food. Let's make sure that everybody has got an equal opportunity to buy the goods that they need.